The world's second most populous nation now has the third highest caseload of COVID-19 in the world. India has crossed the 1 million mark. The country now has more than 10 lakh confirmed coronavirus cases, out of which 3.4 lakh are active ones. Every day, India adds around 30,000 new cases. The deaths too have crossed the 25,000 mark. The numbers are now being fueled by the B and C towns of India because COVID has reached India's hinterland and the numbers continue to rise.
That's right. India is now in the 1 million club when it comes to corona positive cases. It's a race that nobody really wants to win, but these are the top three nations at the moment: the United States, Brazil, and India, the three countries with the highest caseload of coronavirus cases in the world. Hello and welcome to our special today. India, as I said, with more than 1 million people infected with novel coronavirus at some point of time in the last 3 months. Although the good news is that India's mortality rate still remains lower than the global average, the fact is that the virus is nowhere close to being tamed. The worry is the number of cases that continue to be added every day are rising. You could argue that we are a large country and therefore these numbers are only a fraction. But the fact is the virus isn't going anywhere at the moment. Our focus today will be with top researchers who've been tracking the coronavirus curve. Take a look at this special report.
India's first case of infection from the novel coronavirus came up on 29th of January 2020. Almost 6 months later, the world and India is staring at a new reality. Across the globe, there are 3.8 million people who have been infected, and around 1 in every 4 is an Indian. In 6 months, India has breached the 1 million mark. And although it took the virus almost 2 months to infect 1,000 people across India, it took less than 15 days for the infection to reach 10,000. From there began the rapid spread. Within another 15 days, the caseload had gone up by 10 times, hitting the 1 lakh mark by 18th of May. And on 16th of July, India's caseload finally touched the 1 million mark. The disease, which has claimed more than 580,000 lives across the world, has killed more than 25,600 people in India. But still, the country's mortality rate has been lower than the global average. It now stands at 2.55%.
भारत में डेथ पर मिलियन पॉपुलेशन कोरोना से होने वाली मृत्यु बहुत कम है, 17.2 प्रति मिलियन है, और अन्य देश ऐसे हैं जहां ये 35 गुना भारत की संख्या से है.
But the low rate brings little cheer because the virus is still rapidly spreading in India. India's COVID-19 curve continues on its upward journey. On 16th of July, Maharashtra, Tamil Nadu, Karnataka, Uttar Pradesh, Andhra Pradesh and West Bengal detected record number of new coronavirus cases. And if that wasn't all, 687 deaths were reported on 16th, making the tally highest daily death toll ever. The onslaught of the virus has now shifted to the interiors of the country. As Mumbai and Delhi finally see some hope of having passed the peak, new centers, smaller cities and districts are now pumping up the numbers, making it clear that India's battle against COVID-19 is far from over, because new hotspots and infections continue to emerge across the country.
That's right. As India breaches the 1 million coronavirus case mark, we've decided to track India's COVID trajectory and understand where the country is headed in the months ahead. For that, I spoke earlier to two of the top COVID experts at the moment. Dr. Ashish Jha is Director, Harvard Global Health Institute, and Bhramar Mukherjee, Professor Epidemiology and Chair of Biostatistics at the School of Public Health, University of Michigan. They've been tracking India's corona curve for several months now. Let's listen in to them to know where the country stands in terms of COVID. With recovery rates at about 63 to 65% and mortality rates at about 2.5, 2.6%, I want to get both your assessments as to where India stands. Why don't you start, Dr. Jha, first?
Sure. Thank you for having me on. So India is in a concerning situation. There are almost 30,000 cases being identified every day right now, and that grows every day. Every day I look at the statistics, I look at the numbers, it is growing. And of course, the big question is how much further will it go? When will we see a plateauing? And that will be really driven by policy. It will be driven by how much we can maintain control of the outbreak, how much social distancing. I'm happy to see some improvements in testing, but I feel like India is still in a very precarious situation, and I'm worried about the days and weeks ahead.
Professor Mukherjee, you've been tracking it on a daily basis since March. Are you equally worried?
So first of all, thank you for having me on the show. I'm not surprised by the numbers because back in May, we predicted that by middle of July, India is going to cross the million mark. And in this situation, I would have really been lucky to be wrong as a modeler, but the numbers are coming to be true. I'm concerned. I'm concerned because I'm concerned, but also have a ray of hope. I'm concerned because the numbers are growing every day, and many states are rising, and the disease has spread from the West Coast and Delhi, as we all know, to the Eastern Coast and the southern states. So what I envision is a cascade of peaks waving through the country in the next couple of weeks. And I find the concept of a national peak to be quite nebulous for this reason. But I also am hopeful because we have seen models of success. For example, if we could do it in a low resource setting like Dharavi, where the odds are stacked against us, so that shows that is doable. It's doable with symptom tracking, community engagement, and one thing which is very critical for India, I think, is the centralized isolation and quarantine, putting the person out of the household so that the entire household or the congested neighborhoods do not get infected.
But you know, one of the concerns, you mentioned Dharavi there, Professor Mukherjee, but Dr. Jha, the concern is that while in Dharavi the signals are positive, just take a look at certain other suburbs of Mumbai, distant suburbs where the numbers are rising very sharply, or indeed Pune where we've got another lockdown, or Bengaluru now where the numbers have suddenly exponentially risen just in the last 10 days. Is this something that one should expect, that we will have different parts of the country registering different peaks at different periods?
Yeah, so I completely agree with everything Professor Mukherjee said. Absolutely right. So what's really important about the Dharavi example is that it shows that it can be done, and it can be done in low resource settings. So that can no longer be an excuse. And now when you see outbreaks that are not getting under control, it's not because there are not enough resources. It's because people are not taking it seriously enough, and they're not applying the tools of public health that we know work. I do expect in a country the size of India, I agree that it won't be one peak or one fall. It will be different places in the country having different peaks at different moments.
You know, I want to get Professor Mukherjee, your view as well, because, you know, the positive signs, some are saying India's doubling days now increased to 20 days as compared to 16 days a month ago. All the major states like Maharashtra, Tamil Nadu, Gujarat, Haryana showing a downward trend with their reproduction rate coming down less than 1.5%. Should we be looking at these as positive signs, or is the real sign that we should be looking at every day mortality rate, that is critical to get it down from, say, 2.6 to below 1%?
So first of all, I think that every human life is very valuable. And so when I look at the data, I look at the number of active cases and try to project that in a given region and estimate that how does that compare with the number of hospital beds and ventilators that we have. So I feel that doubling time and hours are important metrics, but on an absolute scale, they don't tell you how many patients are going to show up at the hospital. So we really need to make sure that there is not a surge and the number of active cases that we are predicting in the next 2 weeks. That's why it's incredibly important to track the pulse of this pandemic with data so that you can anticipate the healthcare capacity and scale up healthcare, scale up testing. So I think the R for the nation has actually, if you look at the data for the last 14 days, has always vacillated between 1.2 and 1.3. So even if some states are going down, the nation is not really going down to 1.1 and closer to unity because the other states are really rising up. So this is the pattern, and that's why we cannot really surrender to destiny and be complacent, because this is a very serious virus. And unfortunately, we would like to all go back to normal life, but we are in a very long and painful crisis. And we have to learn how to get used to this pause, restart, and drive mode of leading, living, and learning.
You know, you mentioned at the outset about testing, Dr. Jhabbar. We have seen wide variations again in testing. If you look at the numbers for a Bihar, and you compare that, let's say, with the Tamil Nadu way up testing per million. Look at the numbers in Bihar, way down, just over 3,000 tests per million. So there's a sense that certain parts of the country are not testing enough. Does that worry you, these wide variations in testing?
Absolutely worries me. And, you know, being from Bihar, right, being born in Bihar and growing up in Bihar, I particularly look at states like Bihar and UP and Jharkhand and places with fewer resources. And I worry a lot, because what will happen is that the virus will start spreading. I assume it already is. I think it already is in these places. But without testing, we won't know. We will be blind to it until it becomes very widespread. And then controlling it will be very, very difficult. So we need a national testing strategy. I understand that individual states, of course, have a role to play. But we really need the central government helping states like Bihar and UP and Jharkhand and other poorer states make sure there is adequate testing capacity, or the whole country is going to suffer for it.
Is that the worry, Professor Mukherjee, as you look at the numbers, that maybe now, after the first sort of wave, if I may call it, of coronavirus cases was centered around the big cities, the Delhis, the Mumbais, the Chennais, it could now spread to the poorer parts of the country, the Odissas, the Bihars, the Bengals, and we're not getting enough data out of that, authentic data, believable data?
I'm completely with you on that, because we see that the calming down effect in the Mumbai, Delhi, as well as Tamil Nadu, and the R in Delhi is 0.8, the best in the country right now, and Maharashtra is at 1.17, and Tamil Nadu is at 1.05. But Bihar we see at 1.6, West Bengal 1.5. So these are all escalating. Karnataka, they're all escalating. And so I think the data, India in terms of health is, I think, a data deficient environment, and that's hurting us really poorly. A lot of the deaths naturally are not medically reported in rural areas in these states. And so I feel like we are talking about a fraction where we do not believe the numerator and we do not believe the denominator. We do not believe the number of deaths. We do not believe the number of cases. So I think we are really trying to fight this blindfolded. And testing should be increased, and you saw a value of that and impact of that in Delhi. And that Delhi has tested the largest fraction of its population, 3% about. Right. Overall, national India, it is still less than 1%. And Bihar is at 0.3% of its population has been tested.
You know, that's critical. You know, unless you test more, you're not going to really know the scale, presumably, of the problem at the moment. Am I right, Dr. Jha, that we just don't know how bad it could get? Everyone is throwing these various numbers, but unless there is greater testing, we really won't know what exactly is the scale of the problem in India. Am I correct?
Absolutely correct. And this is why things like recovery rate, case fatality rate are not very useful, because, as Professor Mukherjee said, they are shaped by who you test, who you identify, and how well you do on accounting for mortality. So right now, I would say we have a very small fraction of the picture. If you were to, the best estimates out there suggest that the number of cases that we are missing maybe 2 or 3 times greater than the number of cases we are identifying. And until you get a lot more testing happening, you're not going to be able to identify those cases. You won't know where the hotspots really are.
Are you saying, that the number of total cases are actually 3 to 4 times more than the 1 million plus mark that we are reaching at the moment?
I would not be surprised. I believe, look, that is true in almost every country that has not had adequate testing. The best models out there right now suggest that the true number of cases in India are probably more than 1 lakh a day, the true number. But we're only identifying about 30,000. And in terms of how many people have actually been infected, I'm confident it's much more than 1 million. It's much higher. We just don't know because we have not had testing, and so we have not been able to identify most of those people.
You know, the good news, Professor Mukherjee, is that today Moderna, American biotech company, actually yesterday announced that its COVID-19 vaccine is finally going to enter its final phase on the 27th of July, showing positive results in previous human trials. Are you seeing a breakthrough on the vaccine front? Because that's the big question that everyone is asking.
So I think that, I'm not an expert on vaccines, so I don't think it would be appropriate for me to talk about it. But just like a avid researcher in this area, we are all bracing for the vaccine to come through. But we have to be mindful that we are thinking about the vaccine is the solution. But even after it's developed, the dissemination of it, administration of it, vaccinating a substantial portion of the population, of the world population, it's going to take a long time. So there is no magic solution. The virus is not going to magically disappear with lockdown. As soon as a vaccine is discovered, we are not going to find the overall solution to this problem. We have to be very patient and really have our guards up. And community engagement is very critical in this public health crisis.
Professor Jha, are you more hopeful given the fact that that really is eventually the solution?
So I am optimistic about vaccines, but I'm going to echo a couple of points Professor Mukherjee made. My best guess is that we're not going to have one vaccine, we're going to have many vaccines. I've been tracking them very closely, and I suspect we will have data that they are safe and effective sometime early in 2021. Then there is going to be an effort to ramp up 4 or 5 billion doses of these vaccines. That is an incredibly difficult thing to pull off and to do it effectively, we're going to run into supply chain problems. So I think realistically, India has to plan for broad-based vaccines available and administered to the Indian population sometime in the second half of 2021, if everything goes very, very well. If everything goes very well. So we have to be patient. We are early in this pandemic. We have a long way to go, and we have to have policies that let us get through the next 12 to 18 months until a vaccine becomes widely available and widely administered.
Let me ask both of you, therefore, in conclusion, give me a horizon, if possible, of the next 3 months as you see the India situation. Look at the way cases have doubled. Looking at that, Professor Mukherjee, where do you see India being in the next 3 months? If I were to look at, let's say, October, which is festive season, will we have good news, or do you think it'll get worse before it gets better?
First of all, October is a festive season, and I desperately want to go back and visit India and visit my loved ones and my parents. So I'd really, in my wishful thinking, I'd like it to disappear, and I'd like my models to tell me so, but they're not telling me so. So the fact is that I think that this is, we need a long-term strategy, and also an acceptance that we are in a crisis period of civilization. Headline management is not the way to get out of it. We have to really also prepare ourselves psychosocially, because we are just talking about COVID cases and counts. We are rarely talking about what is it doing to our society. But so psychosocially, I think we need to prepare ourselves that how we can manage and mitigate these risks at everyday life. It's going to get better, but it's not going to be fully like before. The new normal, the acceptance of the new normal is very, very important right now, and still be practicing all the basic public health things that have shown to be effective. Not gather in indoors, wash your hands, wear masks, and keep at it. It's very hard. It's easy to get tired, but we cannot give up. We cannot surrender to destiny.
Professor Jha, you want to give a final word as a good Bihari?
As a good Bihari, I will say this. Whether India becomes the global hotspot for new cases, or whether India becomes a success story for how to manage this very difficult pandemic under difficult circumstances, is up to us. It's up to the Indian people. It's up to the Indian political leaders. There is a lot we can do within the resources we have. If we do the things that Professor Mukherjee's talked about, get rid of indoor gatherings, maintain a modest amount of social distancing, ramp up testing, get everybody wear masks, wash hands, all of that, India can become a global success story. I think that is what Professor Mukherjee wants. That's what I want. I think that's what we all want. And we've got to push our country to making that happen.
Very, very quickly to both of you, re-lockdown in several parts of India. Do you believe that's the right thing, Professor Mukherjee?
I think, if you do lockdown, the number of virus cases are probably going to go down. But I do not think that's feasible. I feel that regional, modulated, punctuated lockdown is going to be the new mode of life. And really watch that data so that you don't wait to see the cases on the ground, but actually you can arrest the outbreak in its nascent phases.
You want to also take that, Dr. Jha? Is that the only strategy now, to have these very, very localized lockdowns?
So I think localized is good. Outbreaks are local, so you want to have your responses be very local. As Professor Mukherjee said, you got to have it driven by data and evidence. That requires testing. And this is a virus that punishes you if you fall behind. So being ahead of the virus is always the better way to be.
Professor Jha and Dr. Jha and Professor Mukherjee, appreciate your joining us. You've given us a sense of what could lie ahead. Thank you very much for sharing with us your insights here on India Today.
Thank you.
Thank you for having us.
That's right, India at 1 million. What can one say? The COVID virus is, it appears, here to stay. The experts are saying live with the virus, but also be ready to chase it and fight it. To all our viewers, I know these have been tough times. All I can say is stay well, stay safe. Thanks for watching. Bye for now.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.